Hi, welcome back to Elder Care Answers. I'm your host, Doreen Seamon. Earlier on our show today, we discussed how your estate planning foundation can protect your health and your nest egg. We also discussed with Lincoln Kincaid of Dynamic Physical Therapy how physical therapy can help you maintain your mobility and quality of life for as long as possible. Sometimes, though, despite our best efforts to take care of ourselves, we're still faced with a terminal condition. When that happens, Hospice Services provides quality end-of-life care to ensure our loved ones receive the care, comfort, and dignity they deserve. Today, we have Michelle Hopkins with us to explain how Mon General's Morgantown Hospice provides this care to our community. Michelle is the coordinator of Hospice Support Services for Morgantown Hospice, a service of Mon General Hospital. She's a West Virginia University graduate with master's degrees in social work and public administration. Michelle was raised in Morgantown and still resides there with her husband and 2 children. Michelle, it's a pleasure to have you on the show today.
Thank you, Doreen. It's a pleasure to be here with you today.
Michelle, what exactly are hospice services?
Hospice services include physical, social, psychosocial, and spiritual care for terminally ill patients and their families during the final stages of their illness. Services include nursing care, volunteer support, spiritual counseling, and bereavement support in the patient's home, personal care homes, long-term care facilities, and assisted living facilities. The patient must have a physician who agrees to follow them through hospice and who agrees to write a physician's order. All of our patients must have a prognosis of 6 months or less to live, but that does not mean after 6 months that they would have to be discharged from hospice services.
So if a patient's receiving hospice services, does that mean that they can't see their doctor anymore or be admitted into the hospital again?
That's a common misconception about receiving hospice services. Even when a patient signs into their hospice benefit, they can still go to see their physician and be admitted back into the hospital. We always encourage our patients, if they're feeling up to it, to continue to see their doctor. We try our best to make sure that our patients' pain and symptoms are managed in the patient's home, but there are times when patients must be readmitted back into the hospital for pain and symptom management.
Michelle, it's so nice to know that these important services can be available to us wherever we might be in our final phases of our illnesses. But can you tell us more about the specific services at Mon General's Morgantown Hospice?
Sure, I'd love to. Mon General's Morgantown Hospice was the first hospice agency in Morgantown. We only serve Mon County and are considered your community hospice. We have been serving our community for the past 27 years. We have 3 medical directors. One is Dr. Charles Bell, Dr. Gabriella Horvath, and our newest medical director is Dr. Vincent De La Garza. Dr. De La Garza is a medical director at Sundale Long-Term Care Facility, who will also be opening up its hospice and palliative care wing in the months to come. All of our RNs have extensive training and are certified in hospice and palliative care. We do have other disciplines that can help provide pain and symptom management, such as music therapy, pet-assisted activities, Stephen Minister volunteers, and legacy riders.
In my law practice, I often work with families who have a loved one who needs hospice services. Why should these families choose Mon General's hospice service?
Since Mon General's Morgantown Hospice was the first hospice in Mon County, we have developed trust among members of our community and truly have a reputation to provide the best quality end-of-life care to members of our community. Since we only serve Mon County, our patient-to-staff ratio is low to ensure all of our patients and families have the most one-to-one care as possible. Morgantown Hospice is ethical, competent, caring, and truly treat all of our patients and families as though they're our own family.
It sounds like Morgantown Hospice really does provide the compassionate, quality end-of-life care for patients and their families. I know many of my clients whose families are facing these issues are very concerned about the costs and whether they can afford this kind of care. What types of costs should they expect with hospice services?
Medicare and Medicaid pay for hospice services 100%, and most private insurances do as well. Unlike other hospice agencies, Morgantown Hospice does not charge our patients a copay for any of the services we provide. The Veterans Administration also pays 100% for hospice services to their enrolled veterans. Morgantown Hospice also pays for medications related to the patient's end-stage diagnosis. We have our medications delivered right to the patient's door via FedEx. We also pay for medical supplies and medical equipment, such as hospital beds, walkers, wheelchairs, oxygen, bedside commodes, shower benches, and chucks and briefs.
Michelle, that's wonderful news. It's amazing all of this care can be provided even in the comfort of a patient's home without decimating their entire estate. Now, you mentioned some extra help for veterans, and I find that really interesting because in my law practice, I work with a lot of veterans. Can you tell us more about the help that's available to them?
The VA not only pays for hospice services, but also pays for durable medical equipment and homemaker services to eligible veterans. In some cases, patients are not able to safely care for themselves in their home, and their family members are not able to take off work to stay at home. If the patient is a veteran active with the VA, they are eligible for private duty caregivers to come into their home to care for them up to 20 hours a week and have the VA pay for it.
I know that some of our other experts that'll be on another show, Reliable Healthcare Solutions, is going to talk more about the VA homemaker services on another show in the future. Now, Michelle, I have so much more I want to talk to you about. Could you stay with us through the commercial break?
I'd love to.
Great. And if our viewers need more information about Mon General's Morgantown Hospice, how can they contact you?
If they would like more information, they can call me at 304-285-2777. Let me know they saw the show, and I'll be more than happy to provide the information they need.
Great. Stay tuned to Elder Care Answers, and we'll be right back with Michelle Hopkins of Mon General's Morgantown Hospice.